Hi, my name's Dr. Steve Auerbach. I'm a pediatrician and career public health doctor, and we're here today to talk about COVID-19 safety and vaccination for children and all the ways that parents can protect their children and families with the ongoing, not over yet, alas, COVID worldwide epidemic, including here in the United States. So it's important to understand the impact of the COVID-19 pandemic, even on very young children. It's important to understand that COVID disease really does harm children of all ages, even those who are otherwise healthy. We now have vaccination between ages 6 months through 4 years for the first time, as of a week ago when I'm recording this. And that is a great boon for our children and for us as families and parents, because in fact, children ages 6 months to 4 years are at the same risk of severe illness from COVID as are older children and adolescents. And in fact, in that specific age group of just children 6 months to 4 years in the United States, we've had over 2 million cases of COVID-19 disease, over 20,000 children hospitalized, and unfortunately also over 200 deaths. More than half of the children hospitalized with COVID-19 had no underlying conditions. They were normal, regular, healthy kids who got COVID and then were sick enough to need to be hospitalized. The burden of COVID-19 associated deaths in youngest children, such as those ages 6 months to 4 years, as well as in older children and adolescents, is similar to or exceeds other pediatric vaccine preventable diseases. Prior infection doesn't provide as broad a protection against new variants as does the vaccine, and we're always getting new variants. That's just the way viral evolution works, unfortunately. We know that COVID-19 pandemic continues to have a severe impact on families as a whole, and future surges will continue to impact children, and unvaccinated children will remain at higher risk for severe outcomes than children who get vaccinated now. So how can you protect your children from the COVID-19 pandemic? Well, first of all, I'm here to say that COVID vaccination is safe and effective. I got vaccinated as soon as I could. My children are vaccinated. Folks with younger children than I who've asked within my family have asked me about their children getting vaccinated. And I say to everybody, family and friends, as soon as your children are eligible to be vaccinated for COVID-19, please get them vaccinated. The vaccine is available widely and is free of charge to everyone living in New York and everyone living in the United States. So again, it's important that parents get their children vaccinated to protect both them and the rest of the family as soon as they're eligible, which is now down to ages 6 months on up. In addition to getting fully vaccinated and getting all of the follow-up shots, and by the way, remember to get not just your COVID-19 vaccinations, but all the other child vaccinations. We know many children have been missing some of their shots during the pandemic. In addition, here's some additional steps that you, your children, and your family members should continue to take. First of all, when we're indoors, we should still continue to mask. If at all possible, please get N95 or KN95 or other more effective type masks rather than the simple cloth masks. Spend as much time outdoors. It's summer. This is an airborne disease. And so when you're outdoors, in the great outdoors with maximal ventilation, maximal air circulation, it's better, it's safer. When you are indoors ventilation is very, very important. Perhaps some of us haven't historically emphasized this enough. Indoor ventilation is very important. Keep the windows open if at all possible, and have fans to keep the air moving, pushing the air out, getting new air in, and circulating the air. Ventilation is very important. My mantra is vaccinate, ventilate, and keep your masks on when you're indoors. So here's the state of vaccination for children. You may ask, are children under the age of 5 years eligible for COVID-19 vaccination? And the answer now, as of Wednesday, June 22nd, 2022, is yes. Children from the ages of 6 months on up are all eligible to receive the COVID-19 vaccination. Parents can now choose between a 3-dose regimen with Pfizer or a 2-dose regimen with the Moderna vaccine. And by the way, these vaccines are adjusted for the young children. It's a smaller child-appropriate dose. That's the way the testing was done, and that's the way it is super safe to get it done. Vaccine is available for ages 5 through 17 and on up. So at this point, basically, everybody from ages 6 months on up is eligible for the vaccine. The exact vaccine you get, what the dose of the vaccine is, which vaccine, whether it's Pfizer or Moderna, and how many doses you'll need, and the exact spacing of those doses will vary by age. Your pediatrician, family physician, the nurse practitioner, the place you get your shots, they know all the details. No worries. Why should you vaccinate your kids? Well, as we just got finished saying earlier, all children can contract the virus, all children can spread the virus, and all children can unfortunately get sick and even be hospitalized or die from the disease. Even children who've had COVID in the past should also still get vaccinated so that they have a stronger protection against all the future strains of the virus that are inevitably going to become. Again, the virus mutates, the virus changes, and that's just the way it is. But we do know that the vaccine provides a broader protection against future strains than does the prior COVID infection. So what are the risks if your child is not vaccinated? Well, children who are not vaccinated, unfortunately, are more likely to get serious COVID infections themselves, more likely to be hospitalized or even die from COVID disease. They're more likely to get COVID infection and more likely to then spread it to others in the household. They're also, frankly, more likely to miss days of school and preschool and have less opportunities to just play and do all the normal things that we all want to do in terms of getting back to normal. So the way we get back to normal is by everybody who's eligible now, everybody from ages 6 months on up, for everybody to get fully vaccinated and to continue to get vaccinated in the future. So what are the concerns that we know parents have for the vaccine? Basically, is it safe? And the answer is yes, it is safe. It has been tested in thousands upon thousands upon thousands of children, just as it was previously tested in adults. The dose has been specifically made for younger children, and it was tested in younger children. And there were no severe side effects in these younger children. It's similarly in use in all of the other rich countries around the world. They're using it too. As I said, the dose and the preparation for children is specifically made for children, and it's appropriately different than the one that's given to adults. And the side effects that you may have heard about and might be worried about, for example, an inflammation of the heart, is more common with COVID disease, far more common with COVID disease. And in fact, that inflammation of the heart has not been seen in the younger children at all during testing. Bottom line, millions of children worldwide in the United States and elsewhere have already gotten the COVID vaccine. And we know both from the pre-release testing and after it's been out there that children who are vaccinated are less likely to be hospitalized, less likely to die from COVID than children who are not vaccinated. So where can you get the vaccine? Well, Here in New York State, New York City, there's a wide range of places. If you have a healthcare provider already, pediatrician, family physician, nurse practitioner, whoever your primary care provider is, they're already have received the new vaccine for youngest children, and they're ready to go vaccinate. You can, in New York, also visit vaccines.gov. You can text your zip code to 438829 or call 1-800-232-0233 and find nearby vaccine locations. And the vaccine is free. There's no charge for the vaccine. There's no charge for the injection or administration of the vaccine. And this includes the COVID-19 vaccine for children, as well as all adults. So what can you expect after getting your child vaccinated? Well, like with other vaccines, they might feel a little under the weather for the next day and for a day or two. Commonly, a little bit of headache, chills, mild fever, tiredness. Nausea and vomiting is very rare, but can occur. You can give Tylenol or ibuprofen for this, cold compress, and lots of tender, loving care. This passes and is actually milder in younger children than it is in older children and adults. And as I said, the dose, it has been adjusted to be the correct dose, lower dose, smaller dose for the younger children. Will you need more than one dose? Yes. The exact number of doses varies depending on whether it's Pfizer or Moderna and what the age of the child is, but it'll be 2 to 3 doses for the primary series. And then as we've seen with adults, there may be boosters down the road. So what can we all do to keep our children healthy and happy? It's summer. Allow your children to spend as much time outdoors as possible. Even as the COVID-19 virus continues to spread, outdoor time and nature exploration are the safest thing for most kids. When they are indoors, do keep the ventilation in your home maximized by keeping windows open, having the fans or air conditioners running, but with the windows open to keep ventilation with the outdoor air as much as possible. And of course, continuing to follow local health public guidelines regarding mask wearing and keeping some social distance from folks when they're not part of your own household. So what are all the other steps that we can take to protect your child and your family against COVID-19 disease? Well, as I said, most important, vaccinate, vaccinate, vaccinate. Get everybody in your household, including children from ages 6 months on up, fully vaccinated right away. Ventilation, being outdoors as much as you can, and when indoors with the windows open and fans or air conditioners running, blowing that air out and getting good circulation with the outdoor air. And when necessary indoors, especially with people mixing with people who are not in your household, wearing good quality masks such as a N95 or KN95 when indoors. And that includes things like on subways, in stores, on the buses and so forth. Now, some other good practices that are good practices all the time, not just for COVID, encouraging children to wash their hands with soap regularly. Can use some hand sanitizer too, but soap and water is best. Obviously seeking medical care if you or your children have any fever or cough or difficulty breathing. With the latest strains of COVID, runny nose, teary eyes, and kind of more symptoms that you might think are allergy related might be actually COVID with the new variants. When your children might sneeze or be coughing, of course, using a tissue or that into the flexed elbow, and encouraging to dispose of the used tissues right away and appropriately into the garbage and not on the floor or into somebody else's hands to spread the disease. And encouraging your children to maintain a safe distance from anybody else who is sick. And if you or somebody in your household does get sick, then they too should isolate and maintain a safe distance from others. We're all in this together and we need to protect each other. So here's some additional information regarding COVID vaccines for children and adolescents from New York State Department of Health, the New York City Department of Health. And I thank you. And here's to all of us staying healthy.